how to fix inner knee pain in as quick as 2 minutes. This is for individuals who might have inner knee pain that you've been wondering, is this a meniscus injury? And you've Googled it, you've looked everywhere and searched, and you're thinking perhaps this must be a meniscus tear because all the information you find say it's inner knee pain. There's actually a condition you might not be familiar with that I see very frequently as a manual physical therapist. So I want to share about that with you today so you can test yourself, and then I'll show you how to fix it. So very first, this inner knee pain that you're feeling, it's probably like a sharp pain. You might feel some tightness from the muscles afterwards on the backside of your leg as well. And you may notice when you go to move from sitting to standing or standing to sitting, a lot of stiffness and irritation. If that's you, let me show you on the skeleton what we're talking about. When we look at the bones itself in this bony anatomy, this is your femur, your leg bone. These are your two leg bones, your tibia and your fibula, and then your foot. So to orient yourself, this is a left foot. So we're talking about a left knee here. So what happens is there's a shift here at the bones. So what you may feel is you get actually like a shift inside. So if you can watch real close here, you may notice that there's a shift. We call this a translation. So the side shift in of the bone is going to change when you bend and straighten where these bones touch and connect. And a lot of that pressure and that ultimately friction at the knee is what is causing discomfort and often pain. So what we need to do instead is to shift that back so that you can get some relief. So first, let's go into how to test yourself to see, do you have this? Is this tibial shift something that you're feeling? Is you are going to feel where your kneecap is. Once you feel where your kneecap is, this is something I do for patients, and sometimes I teach them what the bones are as we're doing it. You're going to come across the middle and out to the sides. And when you press right in there on that inner knee, so you can also go from this bony part and slide until you get this little divot groove. When you get that little spot right there, you're probably like, oh, that's where my pain is. A lot of patients will jump if you press real hard. So if it's tender there, this may be exactly what you need to help. So this is a beginner exercise in order to help make a change. So you're going to place one hand on the outside of the knee and one on the outside of the leg or inside. So you are going to take the outside of your hand lower here and then the upper up at the knee. And you are pushing opposite. You don't want a lot of weight in this leg either, or it's not going to really work. Put most of your weight if you're leaning down onto this opposite leg. And you're going to push, just gentle pushes. You're not going to get a lot of movement, just a little bit. And you're going to feel a shift. That shift is okay. You want to keep doing this. Keep pressing for about 20 to 30 seconds. You can do more than that if you wish. There's no harm done there. But you do want to do it roughly about a total of 2 minutes. So 20 or 30 seconds, take a break, and work yourself up to about 2 minutes. A lot of people feel a big shift right away, and then other people, it takes a day or two to just really work this motion in order to get it feeling better. So after you've moved the motion, or the joint, now we want to do an exercise to help reinforce that. So the second thing you're going to do then is you are going to put your foot with your toes turned inward, and you're sitting at the edge of a chair to give yourself a little bit of space because we're going to run into the bottom of the chair. So you're going to have your leg with toes pointed in, and you're going to slide that foot in and under as much as you can, and then come back out. And then toes out, toes in, and you're back, and you pull it. You're going to repeat this exercise over and over. You may feel some tightness at the foot or the ankle. That's okay. That just means your body is not used to this positioning. If it's severe and significant, use your judgment and stop if you need. However, a little bit of pinching, discomfort, tightness, if you feel that at the ankle and the foot, don't be alarmed. That's just because it hasn't moved in that angle in quite some time. So test this out. Let me know in the comments if you try it and how you feel about it. And if you don't get full relief with this, reach out and find a manual physical therapist or a online physical therapist like myself who specialize in this and can help further within your state. You can look in the description below for more resources